but right to your door. Volkswagen Newcastle, a member of the Dark Red Group.
The Breakfast Rush, brought to you courtesy of the Willow Tin Group, at the forefront of innovation, and one of the leading competitors in the South African FMCG market.
There's nothing quite like the taste of a traditional family meal, and at the heart of every great dish is a key ingredient that brings it all together. That ingredient is Sunfoil pure sunflower cooking oil, made from only the finest sunflower seeds. It's a perfect way to enhance the taste of your family's favorite foods. Sunfoil cooking oil is more than just oil. It's the key to bring your family together over a delicious meal and making every bite taste better. Remember, the key ingredient to a great family meal is Sunfoil. Tradition just tastes better.
Education, health, dignity, empowerment. These wishes all begin with water. Africa Muslims Agency is committed to providing clean water to the thousands who still live without this basic human right. Support us in giving the best of charities. Provide a water well for 16,500 Rand or a borehole for 55,000 Rand in Afghanistan or 65,000 Rand in Africa. Gain Thawabi Jariyah and help communities to reach their full potential. Africa Muslims Agency, empowering, educating, inspiring.
Get ready for an exciting shopping and dining experience. The Islam Alive Ramadan Fair is back. Join us on February the 7th till the 9th at the David Lander Hall, 5 Crocus Road, Asheville, from 10 a.m. to 8 p.m. Don't miss out on the Ramadan experience. Call us on 083-628-5801 or 082-757-3535. Islam Alive Pre-Ramadan Fair, where shopping and community come together.
The Breakfast Rush, brought to you courtesy of the Willow Tin Group, at the forefront of innovation, and one of the leading competitors in the South African FMCG market.
The views and opinions expressed by the guests and presenters of Radio Al Ansar are not necessarily the views and opinions of Radio Al Ansar and the Al Ansar Foundation.
TBR, it is 90.4 FM in Durban, 105.6 FM in Pietermaritzburg. One of our listeners comes through with a message that says, hot topic needs to be discussed. Absolutely, and that's the reason we're doing it this morning. A shortage of medication in KwaZulu-Natal, public hospitals and clinics. So Action SA in KZN wants our health MEC to take responsibility for this shortage. The party says the health department has allegedly issued a memo stating that medication supplies will only be replenished in April due to budget constraints. In 2019, the department has lost, since 2019, the department has lost nearly 17 billion Rand in budget cuts. On the program this morning and screen as well, we have Action SA's provincial chairperson, Zwakele Nqango. Good morning and welcome back to the Breakfast Rush. Good to see you this morning.
Good morning to you, Nichal, and good morning to the listeners of the radio station. And thank you for inviting us.
Always a pleasure. Now, Action SA has expressed outrage over the ongoing shortage of essential medication in government hospitals and clinics. Can you provide us with a clear picture of how severe the crisis actually is?
Yeah, firstly, let me say, one, acknowledge the fact that there has been budget cuts. That's a fact. The Department of Health and Education have suffered mainly, but they still receive the biggest budget in the country. Both health and education are still getting the biggest portion of a budget, although there are budget cuts. Now, if you look at health department, you are currently holding the employment of nurses. You don't even build clinics. You don't even build new hospitals. None of this is happening. Now, the big question is, after budget cuts, what then do you do with money that you have if you can't even provide the medication? Because those are basics. I understand when you do budget cuts, it means you can only afford the basics. Now, the supply of medication should be one of the basic services that the healthcare system should continuously provide regardless of financial challenges. Now, here in KZN, all one can say, we are facing a situation where we have an arrogant and negligent MEC who will come and try to spin what is going on. I can tell you, for those who use the public healthcare system, they are suffering and they are speaking out. Even when you check social media, they are saying exactly where they are. The challenge is the shortage of medication. And what is worse, Nichal, is around the chronic medication. Because one must say, we are not saying as Section SA, there is no medication at all. We are saying there's a shortage of medication, especially the critical ones. Let me give you an example. Someone go to a hospital and then they are having severe pains. Normally, a doctor will give a person a strong painkiller like a tramadol. But if there's no tramadol, they will give you anything for pain, although they know very well it's not going to help you at that moment. Those are the challenges we're talking about. You've got an issue of a TB patient. TB patients, when they roll the medication, immediately what they do, they also prevent spreading the disease outside yourself to other people around you. That is why when you are a TB patient, you are still able to go home because the treatment you get, it's also preventing the spread of a virus. But in the case where right now, you go to some clinics and hospitals, there is no TB treatment. It means in KZN, we're at risk of having an outbreak of a TB because TB patients are not getting this treatment. You talk to BP patients, they go to hospitals, they can't get assistance. In most cases, these are elderly people or gogo, abumkulu, who are suffering, who can't even afford the private medical services. Now you get some doctors in the public sector to do a script. Some of the doctors, out of love for their job, they know that you can't survive with what they have. They will give you a script and say, go to a private pharmacy and get this medication. Now, this person can't even afford, but you find an MEC and department come and say, no, it's not true. We have medication. It's not really the way we expect government to work. All I did, Nichal, when I wrote to the MEC, I asked the MEC in writing, I said, MEC, please come out to the public, explain to the public what is going on, because people are going to be dying. People are dying every day. The health of a person can't wait for the 1st of April before you get a new budget, unfortunately. The health of a person, people need to be treated as when they are sick. So currently we have a situation where the department can't even pay suppliers. If you check on social media, I even get on my own phone, I get messages from suppliers who are saying, Action SA is correct. We are suppliers. We are not getting paid. I even go as further, even talk about security guards and the health department are not getting paid because department doesn't have money. So we are saying the medication should be the basic services that the healthcare system must be able to provide.
Now, we had a look at the department's page on Facebook, and we are seeing content that seemingly counters your claims of shortages in the province. Is there evidence to back up these claims?
Let me tell you, you will never get a different evidence than what you see on social media. Leave the statement by the department. Read every comment on that page. What people are saying, they are even mentioning the hospitals and clinics where they can't get medication. Some of them are even mentioning what kind of medication they couldn't get from hospital and clinic. So whatever the department can spin, today I confirm to you, I'm writing to the MEC. I'm challenging her to do an oversight with me. I'm saying, I'm going to list all these hospitals and clinics where people are complaining. Let's go there with her so that she can see for herself. Look at what they did. They did a content. They went to a depot. If you see their page, medication, they didn't go to the hospitals and clinics where there are complaints. What they did, they went to a depot. They took a video where there are boxes of medication. Then they saying, here's the medication. We have medication. And go to a depot. We never said there is no boxes in a depot. We said at a hospital where there's a face of service delivery of our people, there is no and pills. So all we're expecting the department to do is to go to these specific hospitals and clinics where people are complaining and able to say, yes, now we are here. There's no problem here. They can't do that because they know there's a problem. So all we must say, our aim as Section SA is not to cause panic, But we are saying, let's address this challenge in front of us, because keeping quiet doesn't help. And I must say, the MEC, by denying this challenge, we're in the crisis mode at the moment. It's a disaster. So what we expect is an ethical leader who can able to say, yes, we've got a problem. Let's engage the Premier and the Treasurer. If there's no money in the province, how can we engage National Treasurer and the President and say, President, we have a disaster in KZN. Please come on board, rescue us, assist, because we are facing a disaster. But if the MEC and department keep denying there's a problem, let me tell you, it's common knowledge. If you deny you've got a problem, no one's going to help you.
This is true. Now, Zwagale, in your view, is this a case of financial mismanagement, or is the province genuinely out of funds to purchase much needed medication?
Look, my honest assessment, as I said earlier, we acknowledge their budget cuts. There are budget issues, but those budget issues are not enough to say you can't supply medication. As I said, the department in KZN have not built any new hospitals, have not built any new clinics, is not hiring any new doctors, not hiring nurses. Now, those cuts, you can say, you associate them in hiring the staff and etc. Even maintenance, I can take you now to Nongoma Hospital. They don't have no water. They are sharing a patient, are sharing a dish. They wash together. It's a condition. I'm from Nongoma. I'm talking about experience, something I can say. I can go there with the MEC and show her. Now, the issue is the Department of Education is still getting the highest part of the budget in the province. Now, the big question is where the money goes, except to say, I can conclude it by saying there is mismanagement of funds, because you still find the MEC doing his imbizo, going around having these videos and having this content. That's a waste of money. Go and buy medication. At least if you can then maintain the hospital, at least provide them with medication. Because when you go to a hospital, Nichal, you are going there to get a healthcare system that is working. Someone must help you. Otherwise, why I must go to a clinical hospital if I'm sick, if I'm not going to get help? Because end of the day, if a doctor, and he said, I must say this, they are putting a much strain to our professionals like doctors and nurses. Because end of the day, they are human beings. They are professionals. I don't believe they are okay. And I talk to them mainly initially. I talk to doctors, most of doctors, they are complaining that it's painful to them to give a patient the medication that you as a doctor, you know very well you want to help a patient, just because you don't have another option. So all they are saying is, sometimes they write a script. Then they do a script to a pharmacist. A pharmacist will come and say, no, doctor, we don't have this kind of medication. We only have these options. That's not how it should work. You must give a patient the medication that will help a patient, not what you think is just a way to get it out of the hospital. Because sometimes just give them something so that they can leave the hospital. That's not how it should work.
So just as a way to end this morning, I'm looking at a WhatsApp that's coming through the studio right now, and one of our listeners sends this through. He says there is also a backlog in public hospitals for tests, things like ultrasounds, etc. You know, your scans and that. There's a backlog for that. Blood test results take an eternity to get back to the doctor. You could go in and give bloods today and be invited back a month later to discuss your results, and in between you could quite possibly pass away. Emergency departments have shortages of doctors, nurses. I'm being challenged right now by my listeners to go and do an outside broadcast at a public hospital. The thing is, we're not exactly allowed to do that. You know, the application process to get an outside broadcast at a public facility is very lengthy. I'm pretty certain, and this listener is pretty certain as well, that the oversight visits that you want to do with the MEC is something that's going to be deducted by the hospital, meaning they know you're coming to them in a week. They will clean up, wash up, it'll be smelling lovely, everybody will be very well dressed, they'll have their very best of staff in front on the day, so that when you get there for your oversight, you don't see the actual situation. You see the doctored situation at the hospital. Your comments on that?
Yes, there's a downside of it. It is possible, but I can tell you, there are issues they can't hide overnight. Hence, the oversight. My proposal to the MEC is they must follow where I'm going, not them telling me where to go, because they said I must be the one who is proving where is the problem. So they mustn't ask me where are we going a day before. They must be able to say now we're going to this place. But at the same time, you're quite correct, because part of the problem as well is that the officials are sometimes being told not to reveal information. There's another downside of it. But one thing they can't stop patients from speaking on their own personal experience. That's what they can't stop. They can maybe bully officials to lie on the camera and say, no, everything is going well. But when you ask patients, they will tell you the truth, their personal experience, because no one can lie and say, I'm getting enough medication here, I'm all sorted, when you know very well not getting a service. So yes, the department can mislead, but from your comment you just read now, I can tell you right now, most clinics, when you go today, you can't even get a paternity test. You know, when you go there, pregnancy test. So someone goes there, they want to test pregnancy. You can't get it. Someone give birth. Some hospitals will tell you after giving birth, you must go and buy Pampers, or your family members bring Pampers, because hospital can't have Pampers when someone gives birth. There's a condition we are in KZN. So for me, it's just surprising when the officials and authorities in our province are the ones so arrogant on this matter and not prepared to come out and say, yes, we've got a problem, yes, we need help. And I must tell you, this problem have nothing to do with what Trump has said. What Trump has said is basically about the AIDS funding will make things worse, because currently we had a problem already. This issue happened before Trump became the president again. You know, it's from last year. It's been ongoing for some of it been going for quite a number of years, but in the main, from last year around June to now, there's been a crisis in the province. But I can tell you, with Trump withdrawing these funds, it's going to be a disaster. We are now talking about TB patient and BP patient. It's going to be worse for HIV patient.
Absolutely. I want to thank you for your time this morning and wish you and your team well in the oversights and praying that the health system is right in the country with your hard work as well. Thanks once again for your time, and a wonderful day ahead.
Thank you.
It is your breakfast rush. That was Action SA Provincial Chairperson Zwakele Mpango on the show, talking about our health system and just judging by the amount of response that's coming through on this subject. We'll go through that on WhatsApp in a little bit from now. We've got to get you your